Public health response is about people helping people. How we respond in threatening situations, with long hours and uncomfortable conditions that wear down our patients, can make as much difference as what we are there to do. As public health professionals, our goal is always to promote good and to prevent harm. We bring to our work a commitment to treating others with respect, fairness, and compassion. But sometimes, especially during an emergency, we forget. Right when it matters most, stress and pressure can make us forget to pause for a moment or forget to look someone in the eye and to put ourselves in their situation. Let's take the case of Sam. During an outbreak of Ebola, he is the leader of a burial team that's been assigned to this village. It's his team's job to safely collect the bodies of people who have died. Sam knows the very first thing he has to do is show his respect for people in the village by meeting with the village leader. The village leader will give the trained burial team permission to be there, and in turn, the leader will introduce Sam and the burial team to the families of those who have died. Once introduced, Sam takes the time to pay his respects to the family, to express sorrow, to explain what's going to happen, and to invite the family to watch the burial from a safe distance. He shows the family the personal protection equipment, which is commonly referred to as PPE, that the burial team will be wearing. Sam knows that if he bypasses these simple steps, word can spread. Without the village leader or village elders indicating their acceptance of the burial team, village members may reject the burial team and decide to bury their loved ones themselves. Ultimately, this would put them and everyone they come in contact with at high risk of infection. In this case, respect is showing understanding of and respect for the local culture, and for safety too. When an emergency occurs, food and water may need to be brought to a community. Elias's job is to distribute these supplies. Elias finds this somewhat stressful, but he tries his best to hold on to his commitments to fairness. He knows that people will be talking whichever way he distributes the supplies. When word gets out that Elias makes sure that everyone gets their fair share and that everyone is treated equally, it builds trust in the community about the entire relief effort. In this situation, justice is served by distributing all resources fairly. While working at a local hospital, Amina is required to wear a mask within 2 meters of a patient. She has learned that if she puts her mask on with her patients and their families watching and speaks to them in a calm voice, it makes them more comfortable. She explains the purpose of the mask and states that she realizes the mask feels strange and scary, but that it's important to keep everyone safe. She has learned that the patients are more likely to comply with requests like these and to complete their treatment if she talks kindly to each patient and the family and explains what she is doing. Here, doing good and protecting from harm means showing compassion and giving treatment too. The technical work we do to save lives is critical. When we remember to do simple things like speak with a calm voice, look others in the eye, and think about how we would want to be treated in the same situation, we can be our best selves and get the best outcomes. Respect, fairness, and compassion are a crucial part of our response. Although this video can be used by itself, it was developed to accompany a detailed guidance document on ethics and disease outbreaks, including a set of PowerPoint slides. All three, the guidance document, slides, and this video, are intended for use by primary responders to disease outbreaks and are available online at bioethics.jhu.edu/outbreak_guidance.